Just had a really interesting case. We've got a professional athlete. Now we call them soccer players. You in the Northern Hemisphere, you'll call them footballers. Guy's just been signed up to one of the Italian teams in the league in Perugia. 3 months ago, what happened was he was training, went to kick the ball, and his foot hit the ground. And since then, anterior ankle troubles have been troubling him on this particular foot. So he's been seeing everyone and just came from the orthopedic surgeon who now wants to resect the ostragonum and provide some surgical options. Now, when he described the condition, I'm thinking, foot stops, leg and talus keeps going, sounded, and from a clinical assessment, it sounded like he had an anterior talar shift or displacement. So we've just had the x-rays done, and remember the cyma line, lateral view? Let me show you what happens. Alright, so what's happening here is, here we've got the talus, talar declination angle 1 degree, so that's not an issue. But the talar navicular line here, and we've got the calcaneocuboid joint space here. If that continued up smoothly, we would find that the talar navicular joint would be around here. So it's about probably 2 millimeters shifted anteriorly. When I look really closely into the joint section, I can see very clearly where there's a discrepancy with the talar actual cyma line continuation. Now, if you look at this at normal size, it's not that obvious, and you could almost say that there's a congruence of that cyma line all the way through. So this is one that's not brutally obvious, but when we look at that medial beam and lateral beam, what you'll see here is again that 1, 2, 3 toes parabola drops back, and now we've got 4 and 5 sitting here. Metatarsal parabola, again, second is longest, first and third are about even. First looks a bit longer there, but there is a significant drop taking place here. So, interesting case here. I'm going to recommend that we actually get stuck into that anterior talar position and really work that talus posteriorly. If we have a look at, we can see the ostragonum. Yep, there is a clear separation here, but just resecting that, and where we've got all the symptomatic signs of neuralgia and anterior ligament strain happening anteriorly, I can't see that that's going to be beneficial to Sammy here. Interesting observation too, our radiographer pointed out, it looks like we've got a bone cyst taking place here. Anyway, hope that helps with some of your cases that you may be encountering for those anterior ankle injuries, and piece together what happens from a clinical presentation point of view, and work on that talus, working it posteriorly so that we can restore the integrity of that cyma line.